Welcome. I'm Molly Milligan with the 50, and I'm excited to introduce our session today titled 5 Months In, How Family Offices Are Leaning In to Battle COVID and Address Social Equity Through Philanthropy and Impact Investing. Before I introduce one of our speakers, I'd like to mention that we will be hosting a live Q&A session on this topic on Friday, July 24th at 2 p.m. Eastern, so please dial in for that. I now have the pleasure of introducing Liesl Pritzker-Simmons. Liesl is co-founder and principal of Blue Haven Initiative, where she oversees a portfolio structured to generate competitive financial returns and address social and environmental challenges. The portfolio spans asset classes from traditional equities and direct investments to philanthropic programs. Liesl co-founded Blue Haven with her husband, Ian Simmons. Their investment portfolios, restructured to be impact-driven, became the foundation of Blue Haven, one of the first family offices created with impact investing as its focus. In addition to working closely with entrepreneurs, nonprofits, and co-investors on companies and initiatives that create social, environmental, and financial value, Liesl develops strategic partnerships with organizations that support and advance more informed investing. Liesl, I'll turn it over to you.
All right, thank you, Molly, and thank you all for being here. That was quite a long bio, but I'll just say a couple more words about our family office before I introduce our wonderful panelists who will tell you about a really, really exciting initiative that they're working on to tackle COVID. As Molly said, I'm Liesl. I'm the principal of Blue Haven Initiative, and that's the single family office that I run with my husband, Ian, and we're based in Cambridge, Massachusetts. And as Molly said, we're one of the first family offices to focus 100% of our assets on impact investing. And what that means for us is we started with a really simple assumption, which is that every investment we make has an impact, regardless of whether we're measuring it or not. It's doing something in the world that involves sort of societies, communities, the environment. And so what we want to do is be really proud of what all of our investments are doing in regard to that, as well as be happy with its financial performance. And so that has led us on a really interesting journey across asset classes and across themes and sectors. And one of the things that we realized early on is that as a family office, we get to have very flexible capital. We get to do things that other sorts of asset owners don't get to do. And what an incredible way to express our values and use that flexibility and sort of think both philanthropically and as prudent investors. And kind of get creative with how we want to lean into our capital. And that really brought us to a partnership with Impact Assets. So we do not have a family foundation. We do all of our charitable giving through the donor advised fund at Impact Assets, where in full disclosure, I also sit on the board and the investment committee. So I'm all in. But one of the reasons that we chose to do things that way is because Impact Assets really supports impact investors in that intersection between philanthropy and investment capital. And actually COVID and what's happening here is a really interesting use case for this very particular type of sometimes recoverable philanthropic capital, sometimes investment capital, and sometimes grant making as well. And so we've got two incredible women here to discuss what is going on at Impact Assets in terms of their COVID strategy. So I'll start by introducing Margaret Trilley, who is the CEO and CIO of Impact Assets. And Margaret has a long career in finance, but just before she joined Impact Assets, she had a boutique advisory firm, which worked on custom direct investments for family offices. And Margaret also serves on boards and investment committees of lots of family offices too. And then Christian Peel is the director of Stop the Spread, which we'll be hearing all about on this call today. And she has been working at the intersection of social justice and strategic administration for more than a decade. She was deputy director for White House operations under the Obama administration, and also has a background in strategic consulting. So with that, I'll start actually with you, Christian. Can you tell us what is Stop the Spread? And how is it different from just sort of sending masks to hospitals?
Yeah, it's a good question, although that's important too. So Stop the Spread is a program of impact assets. And Stop the Spread uses an innovative model to identify assets within the private sector, within companies across the country. And we think creatively about how to pair those assets to facilitate movement in COVID response and in COVID relief. And as part of that partnership and thought leadership work, we have amassed as well a pipeline of investment opportunity representing some of the cutting edge, some of the cutting edge in terms of initiatives within COVID response. Those initiatives or our pipeline of opportunity include opportunities in PPE, ventilators, but also critical needs like testing, therapeutics, the development of vaccines. We're thinking about food security and return to work. So Stop the Spread is thinking creatively about how we use resources to energize COVID relief at such a critical moment.
So how did it start? How did this all kind of come about?
So Stop the Spread is, and you, unfortunately, Liesl, you've heard me use this line before. Stop the Spread's the ripe old age of just about 13 weeks. So Stop the Spread came to be as COVID was becoming a reality, a public reality in the United States. And it started with a call to action. So a group of CEOs back in the middle of March wrote an op-ed in the New York Times calling the private sector and the business community to stand up in the fight against COVID and to use the resources available to them, to harness the power available to them to help those hit hardest by the crisis. More than 1,000 business leaders responded to that call to action in a matter of days. And tell me how. And that energy or that movement has become the program of Stop the Spread within Impact Assets.
So can you give me some examples of some of the things that are in the portfolio and why this type of, like, why not just a straight grant? What are the kinds of examples of what these businesses are doing or the opportunities that are out there?
Mm-hmm. So our pipeline represents just an incredible amount of opportunity, much of which is connected to serving communities hit hardest by COVID. So we're looking at leaders of color, women in leadership. We're also thinking about communities of color, poor communities, so deploying capital to initiatives that will support those spaces in particular. As an example, we have in pipeline in our testing space, some of the most interesting developments in testing opportunity, not just sort of tests that are relate to diagnostics within labs, but we're thinking about take-home opportunities, like how do we make testing, how can we scale testing opportunity and make it affordable, not only for folks in urban spaces, but for folks in poor rural spaces as well. In our PPE pipeline, for example, we have manufacturers who used to work in textiles or clothing making, who've now transitioned to manufacturing non-medical grade PPE for the communities they live in. In our food security pillar, we have examples of relationships or partnerships forged between restaurants in a particular area and social services agencies in that same area, and volunteers, such that restaurants are creating meals for folks who receive services from social services agencies, and volunteers deliver those meals. So our capital helps to make new supply chains in food security in certain regions. So those are some systems change examples, which is part of what makes Stop the Spread so special. It isn't just about sort of the result of the work. We actually want to deploy capital to initiatives that have the ability to change the landscape of opportunity for those hit hardest by the crisis.
And so one more quick question, and then I'll come over to you, Margaret. But why not? So with something like this, there's a call to action for all these CEOs. There's a lot of energy behind it. Why not just sort of start your own nonprofit, raise a bunch of money, go to work? Like, why this partnership with Impact Assets specifically?
That's a great question. So you'll be hard pressed to find an actor in the impact investing space better suited for this work than Impact Assets. Impact Assets has a history of social impact and a focus on social equity. One of the sort of values of Impact Assets is invest with meaning. So Stop the Spread's kind of core of systems change and vulnerable communities first, all of that is in perfect alignment with sort of the history and purpose of Stop the Spread. Impact Assets also, and Margaret can speak even more directly to this, represents investing infrastructure that allows the Stop the Spread model to function with ease and to flourish with ease. For the same reasons you said, Liesl, you sort of trust your investments to an actor like Impact Assets because they're so excellent at what they do. And so there was sort of no question that we would be leveling up as a movement in partnering with Impact Assets.
Great. And so Margaret, maybe taking a little bit of a step back, tell us more about how Impact Assets kind of operates, and again, what it was like to sort of see this opportunity and kind of slide it in to the work that Impact Assets does.
I'd be happy to. Thanks for having me. So right about the same time that Stop the Spread was coming to be, we were having our own moment of reconciling what our role is meant to be in the space. Typically, we work with our clients who are family offices and family foundations and some really big institutional foundations that work in the billions. And our role typically is to help those organizations find the gaps in any sort of issue, whether it's climate change or social equity, and find the gap between what the public sector is funding and doing and the private sector is funding and doing, and where are those critical gaps, and how can philanthropy and impact investing plug those critical gaps in a way that only philanthropy can. And so we were looking at our role in the COVID situation, and we were in conversation with all of our largest clients about what they wanted to see from us and how they wanted to address the crisis. And together, we organized our own response to COVID, which centered on our frontline heroes, preserving the progress against social equity and climate change, and then also business and community resilience, people who are hit hardest by the economic downturn. And so we had stood up this program of investing, which was very customized for our largest clients. We also made them available to our whole client base through a series of charitable funds. And as we were talking to one of our other clients about this in the Walton Family Network, we were referred to or introduced to Stop the Spread because they were hearing some of the similarities in work, particularly around our work around frontline heroes. And I don't think any of us could have imagined that we would be here today as a combined entity, but as the conversations ensued, there were more and more synergies, and there just seemed to be this really nice fit between what Stop the Spread was doing, what Impact Assets was doing, and ways that we could complement each other's work. And as Christian said, really up-level the effort across the board. We were, in taking partnership with Stop the Spread, we were able to really deepen our understanding of the landscape and our resources to really stay on top of the evolving landscape, because things are moving so fast in this pandemic as we actually learn what this virus is, how it spreads, and what the impacts of it are. And we needed to be agile and fast, and Stop the Spread brought us a dedicated team that is 100% focused on that with depth. They also brought along with them a really large network of advisors that are really renowned in the scientific community, as well as other parts of the business community, and the thousands plus CEOs that Christian referenced. So really a lot of expertise and human power in trying to unpack and unravel and create strategy real time for the crisis. And then we had all of our investment structure, our investment know-how, our 9-person investment team already pointed 100% at COVID and ready to deploy assets in a meaningful way across those 3 areas of beneficiaries. And the fit couldn't be better in terms of what Stop the Spread can tee up and what we can activate in terms of capital and funding.
So tell me a little bit about sort of how the fund actually kind of operates and the different areas that you're specifically focused on, because it's a big, you know, there's and Christian, as you were mentioning, there's economic resiliency, there's testing and vaccines, so how are you figuring out what to prioritize and what to focus on?
It's constantly changing. I'll say that to start, which is the challenge of COVID. But we're organized to stay on top of that. We focus on the highest impact areas at any given point in time, and we also want to move capital with speed. So the funds are set up as charitable funds. They take in grants and also recoverable grants, which kind of look like an investment. But they deploy grants and investments. So the funds can make loans, they can take equity investments, whatever is the most efficient way and quickest way to move capital to the companies or the organizations or the people that need funding. And in that way, we're fast, but we also have the ability to recycle capital. So if someone repays a loan, we can send that money right back out again and address another person in need or another project that's creating PPE or another testing solution, depending on what the needs are and what is most important at that point in time. So we know that this is not a short-term thing. We are still seeing shortages and have been. There was no moment where supply met demand for PPE. It just fell out of the press. We are still seeing, really big gaps in supply and demand there. And we don't have a testing solution. We don't have vaccinations. We don't have treatments. All of these areas still need funding. And we know that this virus is going to be with us for some time. And the economic effects are going to be felt for years. So the ability to recycle that capital as this evolves is, I think, a really key design element to making sure that we continue to address the needs as they evolve.
And how much, just in terms of pipeline, how much pipeline are you seeing in this sort of coming to you, and how do you find it?
Well, it depends on the pillar that we're talking about, but initially we had identified more than $1 billion in investment need. So almost the sky's the limit, really, in terms of need when you include the individuals and the businesses that have been impacted by the economic downturn. Mm-hmm. And in terms, and the sky's almost the limit actually when it comes to the investments that need to be made also on the health crisis. There's deals of all sizes are coming to us, as small as 75,000 and as large as hundreds of millions when you're talking about vaccinations and treatments. And again, we're not looking to fund the hottest idea. We're looking to fund the gaps. And an example of that might be something that the NIH would fund for point of care testing that requires a lab like LabCorp or Quest to process the results. That is not mobile, that is not fast, and it's not going to serve communities that are more remote, that are that are low income communities, that are typically people of color. And so funding the part of that project that gets it to be used on a device that is mobile, that is lower cost, that can generate real-time results in the field is the adjunct or the part of that project that we would fund, so that project can deliver on the promise of making sure that there's access to all the things that are being developed for everyone who needs it, not just the people who are close to a big lab.
I think that's such an interesting point around why this kind of flexible, I don't know, I always feel like, people are either really comfortable with a grant that is 100% loss, or they need a market rate investment. And these things that are kind of in between often sort of fall by the wayside, or are kind of difficult or confusing to wrap our heads around. And I feel like there's so much interesting work to be done there in a way that is more sustainable than 100% grant, with organizations that are more accountable to that capital because it's recycling. But it just requires being able to handle like a zero interest loan, which bizarrely is very difficult. So I think you've hit on a really key sort of element. And actually, Christian, maybe I'll come back to you around how have, and Margaret alluded to this as well, of over the 13 weeks that you've been in existence, how has the needs changed or evolved, or do you think it'll be kind of cyclical and things start coming back?
Yeah, it's a great question. I think sort of the precursor to that question for me is how we monitor the way the crisis is changing and how critical needs within the crisis are changing. So we have this sort of three-pronged model, which we've sort of referenced in different ways at this point. We think about partnerships, we think about our investment pipeline, the deployment of capital, and we also think about research and thought leadership. And the movement of our team between those three pillars kind of enables us to keep a pulse on tracking how data around the crisis is telling us what the critical needs are at the moment. So whereas in early March, the critical need was around ventilators and the availability of PPE, medical grade PPE for our medical frontline staff, that quickly shifted into sort of a research possibility in the realms of testing and therapeutics, vaccines in terms of virus prevention, yes, but also vaccines that sort of lessen the impact of the virus once acquired. So just tons of landscape in all these areas. And now we're seeing, as we move into yet another crest or phase of the crisis, we're seeing the economic downturn intersect with the public health crisis. And hence, food insecurity in the US is much worse than it was even as recently as February. And the front line, this now includes essential workers who are not working in medical spaces, the majority of whom are people of color who are returning to work now. How do we send the workforce back safely? Those are some of the evolutions we've seen. Best case scenario, a virus like this would be linear in its need, but we think it will be cyclical. So the ventilators, the PPE need, we will see again as we experience second waves in different parts of the country. And so our work with Impact Assets allows us a lot of agility and flexibility for responding as the crisis demands.
That's great. And Margaret, so as you've been kind of scaling this up within Impact Assets, how are family offices engaging in this fund?
We're seeing folks engage in a number of ways. So, like I said, we've set up a number of funds that are dedicated to each of those three areas of beneficiaries. The Frontline Heroes Fund is actually renamed to the Stop the Spread Fund, and we have a fund focused on preserving the progress against climate and social inequities. And we also have another fund set up for business and community resilience. This is lending to the folks that impact investors have always focused on, the unbanked, low-income people, people of color, people in communities that have a hard time getting financing. So, so all of those are set up in a fund perspective. We have also, for our larger clients, we have the ability to customize a response. So if folks are interested in supporting their community, their geographical community, or certain demographics within their community, or we had a client whose clients were largely construction companies, and so they wanted to lend to construction businesses, and we were able to focus in on that. So we're able to really tailor our strategies to our clients who are working with us with more significant dollars. And then the final way people have been getting engaged is actually helping us on the operating side. So funding the actual program of Stop the Spread with grants to help us continue the work there now that they're a part of Impact Assets. So it's been, there's lots of different ways to engage, and there's other materials available for folks if they're interested on our website, as well as you can ask for more information on engagement at impactassets.org.
Great. Well, we've just got a couple more minutes left. So just before we wrap up, is there anything else that you would want this family office community to know about either Impact Assets or other ways to get involved with COVID response?
Well, I'll say a few things and then I'll let you comment also, Christian. As we've gotten deep into this work, we've been partnering with folks all over the ecosystem, including the NIH, including leading epidemiologists, folks at Stanford and Harvard, and all of the best thinkers on this. And as we do these landscape analyses, we're seeing that the government is responding in certain ways in lots of different places. It's varied, and commercial investors are investing in a certain area, and there are more critical gaps in this systems environment than there are in most cases, which means the lift for us as philanthropists and impact investors, our role is so critical to solving this problem. It's these are all important pieces of the puzzle, but this one in particular can't be solved by the government effort and the effort of private markets. This is going to take all of us, and especially philanthropists. So I would just leave you with a call to action. We're far from over, and people have done a tremendous amount of work already, and we're going to need to continue.
I second what Margaret offered. There is sort of no better final word than a call to action, and for the good work that's already been started to continue. This time of crisis is unprecedented, which means that our ingenuity in thinking about our available resources and deploying those resources to those who need them most have to sort of match that same level. Like, we have to match the same level of intensity and innovation. And it's a real thrill to be a part of an investing community that wants to be asking these kinds of questions and using capital in unique ways, so that we turn the tide on wellness for the communities who need it most right now.
Well, great. I just want to say thank you to Christian and Margaret and Molly for having us. Just to wrap up, I mean, I think this is one of the reasons why when we were thinking as a family how we want to sort of, what are we going to do in response to COVID? One of the sort of quick ways was to see what Impact Assets was doing. And to be able to know that there's a really comprehensive and very thoughtful way of approaching this. And so we are also, proud to be investors in the fund as well. And so, yes, I would just say to the rest of the community as well, really that sort of precious, flexible capital that family offices always say they have, and patient long-term thinking extends also to philanthropy. And there's really, really high leverage ways in this particular moment in time to lean into that weird space in between, a pure grant and a pure market rate investment. And I think this is one really exciting way to do that in the COVID way. So we'll end here, but I would also encourage everybody to come and join us again on July 24th for the live Q&A, where we'll be back to talk more about Impact Assets and Stop the Spread. So thank you.